Thanks.
Thank you.
Thank you so much for joining us today for the featured session on student-athlete health, safety, and performance. I am really excited to be in front of the entire membership for the first time. My name is Dr. Dina Casiro, and I am the brand new Chief Medical Officer of the NCAA, just finishing my 5th month on the job. My background is in athletic training and primary care sports medicine, where I was a team physician at both the collegiate and the professional level. Most recently, I spent almost 10 years at the University of Connecticut as the Senior Associate Athletic Director and Head Team Physician. And as CMO, I plan to bring my perspective of being both an athletic trainer and a team doctor to the work of the Sports Science Institute. My focus is on building enhanced relationships with those on campus, facilitating practical guidance that is based on membership need, increasing efficiency, all while making sure I keep it focused on the student athlete. Before we get into the panelist discussion, which I am so excited about today, I wanted to give you all a very high-level overview of the historical and current efforts by the NCAA to promote student-athlete mental and physical health, safety, and performance. And I'll start my remarks today by reminding you all about the NCAA's health, safety, and performance strategic priorities that were endorsed by the Board of Governors. And those are mental and physical health, sport-related illness and injury, training and performance, and education and policy. The first area that I'm excited to talk to you all about today is concussion. In partnership with the U.S. Department of Defense, the NCAA launched a landmark multi-million-dollar NCAA DoD Grand Alliance to fund the largest and most comprehensive study conducted in the history of concussion research. And when I say largest, I'm talking about over 50,000 participants and over 5,000 diagnosed concussions. And when I say most comprehensive, I mean 39% of the concussions in this study occurred in women. And prior to this study, most of the concussions that were studied occurred in men. This is ongoing work. The study is currently in its longitudinal phase, which is looking at long-term impacts of not just concussions, but repetitive impacts to the head. The work of this Grand Alliance has resulted in close to 150 academic papers, and this work informs decisions around safety playing rules, return to play, and concussion safety protocols. The NCAA has been a leader in the space of mental health. To our knowledge, it was the first sport governing body to provide guidance on mental health specifically for athletes. In fact, the NCAA partnered with the IOC as they developed their guidance for Olympic athletes. The NCAA's mental health best practices was developed by the Competitive Safeguards Committee and the Mental Health Advisory Group, which is made up of experts from the nation's top mental health organizations, representatives from the membership, and of course, student athletes. The recently updated second edition went into effect on August 1st, and it is legislated that all schools must provide resources and services consistent with the mental health best practices. SSI is currently focused on continuing to support the membership as they look to implement these mental health best practices on their campuses. The Injury Surveillance Program is a voluntary data collection initiative designed to track and analyze medical illnesses and injuries that result from sport participation. Since 1982, athletic trainers have collaborated with the NCAA to create the largest collegiate sport injury database in the world. And I cannot stress enough the importance of athletic trainers in this work. We couldn't do it without them. If your school does not already participate, please consider signing up. The more schools that participate, the more data we have, and the more data we have, the better the outcomes. This data is what informs decisions around playing rule changes. Also, our ISP data request program is due to reopen in January, on January 20th. This program allows individuals from the membership to access data from the ISP for research purposes. Before it went into moratorium a few years ago, hundreds of research articles were published using this data, so we are really excited to get this back online. And lastly, just a quick reminder that legislation exists which mandates that all schools must report catastrophic injuries that occur to their student athletes. Work in the health, safety, and performance space is driven by data. CSMAS is continually reviewing current scientific evidence and student-athlete data to make informed decisions to enhance student-athlete mental and physical health, safety, and performance. Some areas of example where we are using data-driven decisions are around harm reduction as a broader strategy. For example, using education and prevention over punishment. And we are seeing this in the current conversations around sports betting and the recent work around removing cannabis from the banned substance list. So lastly, a quick look at what we are working on in the near future. CSMAS has commissioned the Training and Performance Advisory Group, whose first charge is to address the development of responsible use guidance on performance technologies. This summit will include subject matter experts from the USOPC, the NBA, the NATA, and others. And the summit is set to occur in April. And the outcome of this study will be guidance for the membership around the responsible use of the data that we are collecting from these performance technologies. As it pertains to the athletic training workforce issue, we are continuing to look for ways to support the membership on this topic. During its December meeting, CSMAS signaled its support to amplify the findings of the final report of the D3 Athletic Training Working Group, which they feel clearly applies to all 3 divisions. And if you haven't yet seen this report, I highly encourage you to check it out. They will also likely be re-engaging key stakeholders like Katie, the BOC, and the NATA later this year to reassess the state of the job market. And finally, as always, we remain committed to the continued development of resources and education, such as the SSI Spotlight, which has been a very successful way for us to provide clarity and education on topics and that are directly requested by the membership. So thank you so much for your attention, and now to continue the conversation about student-athlete health, safety, and performance, I would ask you to help me in welcoming our 2 guests, Dr. Marcy Faustin and Dr. Jessica Bartley. Please join me on stage. So welcome to you both. I would love to get started by asking you to take a moment to introduce yourselves, give us a little bit of a glimpse into your experience in the health, safety, and performance space, and a little bit about your current professional roles. Dr. Faustin, let's start with you.
Thank you. Thank you for inviting me here today. It's an honor to be here. My name is Dr. Marcy Faustin. I am an assistant clinical professor at the University of California, Davis. I'm a family medicine and sports medicine physician. I see family medicine patients and sports medicine patients in the general population. I'm also the co-head team physician for University of California, Davis Division I Athletics. And then I'm also the co-head team physician for USA Gymnastics Women's National Team. So I've gotten to go with them to the last 2 Olympics, which has been exciting. In my background, I was a student athlete, track and field at Loyola University Chicago with Sister Jean, which I'm sure everybody knows. And I'm excited to be here because mental health has been something that's a passion of mine since I've been in residency, and something that I think is so integral to the health of our student athletes and really taking care of them as that entire person so that they can be not just successful within athletics, but successful in their careers in life.
Awesome. I'm Dr. Jess Bartley. I'm the Senior Director of Psychological Services at the United States Olympic and Paralympic Committee. So what that means is I oversee all of mental health and mental performance for Team USA. So I was able to go to Tokyo, Beijing, and Paris Olympics, and excited for Milan Cortina and Los Angeles Games ahead of us. I do have a background in professional sports, collegiate athletics as well. Came out of being a student athlete myself. As you may know, a lot of Olympic and Paralympic athletes are also student athletes. And so very excited, and this is very near and dear to my heart as well.
Excellent, thank you so much. Thank you both so much for being here. Before we get into our questions, I want to remind the audience that we do have a QR code up that you can submit your questions throughout our panelist discussion today. So welcome again, and thank you both for being here. In addition to talking about important health, safety, and performance topics, we're really excited to have this opportunity to highlight, as you mentioned, the NCAA's partnership with the United States Olympic and Paralympic Committee. As you know, college sports are critical to Team USA's success at the Olympic and Paralympic Games. More than 80% of Olympians and 55% of Paralympians competed in collegiate athletics before bringing home medals from the Tokyo Olympics. And over 1,300 NCAA student athletes across all three divisions represented Team USA in the Olympics and the Paralympics in Paris this past year. These athletes, and all college athletes, have unique needs as they navigate both school and sport. Within the NCAA Constitution, the association's membership has codified its commitment to conducting collegiate athletics in a way that protects, supports, and enhances the physical and mental health and safety of student athletes. But as the world continues to evolve, so do the considerations around athlete health, safety, and performance. And one area of growth has been around mental health. In fact, at last year's convention, the Board of Governors approved updates to the NCAA's mental health best practices, which went into effect in August. And these updates added considerations regarding the diverse identities of student athletes, NIL, social media, and more. So from your perspectives, how have you seen the space of mental health shift and evolve over your tenure in elite athletics?
I can start, and I'll say that I think with all these changes, what has been really integral to it is having some of these really high-profile athletes speak about their mental health, such as, Michael Phelps or Naomi Osaka, Simone Biles. When these people that are at the top of their sport say that I need help sometimes, and it's okay to ask for that, then it allows everybody else to say, I'm also having trouble right now, and that's okay. And it's really because we're just human. Right? And so what we've been able to see is that more people are coming in to talk about their mental health. Our student athletes in the college settings, they feel more open to talking to athletic trainers, the coaches, the administration, everyone that's around them to say, maybe right now I'm not doing great, but it's okay, I can get help for that. And they know we're here to support them and to really just normalize that this is okay.
Yeah.
Yeah, and I think to pivot off of that, as more and more of these athletes are coming forward, I think what we're seeing as the providers who are supporting those athletes is we have more coaches, administrators asking for education around it. And I think what I see is there's been a bit of a stigma around it, and I think a lot of times coaches or administrators haven't wanted to ask if somebody's doing okay because they didn't know what to say if an athlete was saying they weren't okay. And I think as we have done more education around mental health, as we've done education around like a mental health first aid, when we give education around those pieces, and someone knows what to say, if we can raise awareness and understand what to do if somebody says they're not okay, everyone starts to feel a lot more comfortable. And I think that that's really starting to elevate everything around mental health. And so I think that starts to break down stigma, and that's going to, again, be really circular as we allow more athletes to come forward and to say, I'm not okay. Coaches become more comfortable with what happens if an athlete says I'm not okay. And so again, I think that's going to help the entire system, and more athletes can come forward, more coaches, administrators know what to do if they're actually not okay. And then we know what to do if and when those coaches and administrators have somebody identify that's not okay.
Yeah, I love that. I think, we've been talking a lot about thinking of ways to get training to folks that are not just the medical or the health professionals. And so I'm glad you brought that up, and we'll talk more about that in a bit. Another question I thought of with your comments, Dr. Bartley, was around a lot of times when I was seeing athletes, coaches really care about their student athletes, and I think it's very instinctual for them to want to know everything that's going on in their student athletes' lives, right? That comes from a place of just feeling that connection with their student athlete. But obviously mental health, it brings up an area where we're not able to oftentimes give coaches all of the details about what's going on. How do you have those conversations with coaches and administrators to put them at ease that athletes are in the right hands and being seen by the right people without making them feel like we're keeping them on the outside of the circle?
Yeah, I think that's a great question, and I think it's building trust. And I think a lot of times, Marcy and I were at the Paris Olympics, and we've built those relationships with the coaches, and we're in their spaces, and we're at practices, and I think it's building trust with the athletes, with the coaches, with the administrators, and to say, we've got you, we'll help you identify those issues, and we've got those athletes if something does come up. And I think particularly in the Olympic and Paralympic space, we do what we say we're gonna do and make sure that we follow through on that, and that's been really, really important. And so I think that really goes a long way.
I think in addition to that, within the college space, we also remind the student athletes that they can go outside of the university to seek help, right? Because there is a bias within it, right? There's a bias when they have a goal to succeed for that university. And so where they feel safest is to get help outside, we encourage that. If we need to speak with their outside therapists or their psychiatrists, we can just gain enough information to know that they're being taken care of, but then they feel that they're in a separate space, and then they can go to practice or go to competition and feel okay with that part. And we know that the coaches, they care about them. That's why the far majority of the time they want to know, how is my athlete doing? And we just let them know, we've got them, but we just can't share this much information. And as long as they understand that portion, I find that most people are okay with that answer.
Yeah. That's great, and I think that's a good segue into our next question about pathways to service and pathways to mental health support. Have you all seen some improvement in those pathways over the years?
Yeah, I can start. I think that COVID really highlighted the lack of mental health support that we have within this country, and we just don't have the numbers and those that are trained to be able to help support everybody. But the beautiful thing is then more people are focused on it in order to allow access for that. I'm privileged, we're in the Division I sport, and so we have access to our sports psychologist, our mental health specialist. I'm at a university, and we know how to help navigate insurance to get them connected, but we know that's not the case for a lot of people, and maybe most people, especially when you go into the lower divisions, where maybe you don't have as much resource for that. But we know that you can, go into sports psychology today, or you can always reach out to the USOPC, which I do when I need help for an athlete that maybe is graduating and going somewhere else. And so we've really helped to create those pathways and then to educate the administration and the coaches so that they also know, okay, if we see a problem, we've got support and we have all these pieces in place.
Yeah, and I think just to kind of extend that too, we make sure that there are, as Marcy said, internal, external, there can be in-person, there's virtual options. I think that we've had to get really creative, especially due to COVID, with how athletes can get support, try to meet them where they're at. I think there's more apps than there's ever been, and so I think what we've also tried to do is try to vet a lot of those resources. And so again, I think there's a lot of resources at university campuses, coming to the USOPC, community mental health resources, and again, I think just trying to explore some of those, there's a lot of resources out there.
Yeah, and I think having variety too is important for student athletes. I know on campuses I've been on, sometimes it's helpful having spaces in their athletic complex because it's convenient, it does help to normalize, it helps with the stigma, But it's also important for some student athletes to have those private spaces away from athletics, away from their coaches. And so I think having the variety too is helpful. So one component of the updated mental health best practices is talking about the importance of collaboration and continuous improvement when it comes to mental health services. So what recommendations or strategies do you have for member schools as they work to continuously improve the initiatives and the programs that they have on their campuses?
I mean, I think in a lot of the spaces I've been in is ask the stakeholders, ask the athletes, ask the student athletes, ask the athletic trainers, ask the coaches. I think that's been really key for us. We like to embed satisfaction surveys for our referral processes. We ask, you know, how was this process? We actually follow up after a handful of sessions, like how are you connecting with this particular provider? How was the insurance process if you went outside of the system? And so the more that you ask, and we do that anonymously, and we also really offer and just say, hey, would you be willing to chat about this experience? And really, you know, I think the more honest we can be, the more that we can improve.
Yeah, I love that. Eliciting feedback is huge. Yeah.
And I think when you're eliciting feedback, everyone's jobs are very busy, and so really just having it set, almost have it set for the year, whether it's going to be quarterly or even more frequent or after a big incident occurs. And that way you just don't forget to receive the feedback so that we can just stop, reflect, and say, okay, what changes can we make? And pull in those stakeholders, which is the student athletes. They're the one getting the care, so we need to hear from them.
Yeah, just to wrap up this before we switch to the next topic, I'll just say that on the good news front, we have seen the statistics of student athletes knowing where to go on campus increasing since we updated the mental health best practices. So I do think that this is getting through, and we're seeing evolution in the right direction. So as you both know from your work with Team USA and elite athletes, many of the topics that we talk about in athlete health and safety are intertwined. For example, sleep and nutrition can impact mental health, physical health, and performance. So we'll talk about sleep for a couple of minutes. Data from the 2023 NCAA Health and Wellness Study showed that only 20%, that's 1 in 5 student athletes, feel like they're getting enough sleep to feel rested at least 6 days of the week. Student athletes who had less nights of restful sleep reported feeling more tired from the physical and mental demands of their sport and did not feel that they were performing up to their ability compared to athletes who had more nights of restful sleep. So can you tell us a little more about, in your opinion, the impact of sleep on health, both mental and physical health, and of course performance, and how does this relate to recovery?
Sleep is a big topic, not just for student athletes. I mean, we can ask the audience who feels well rested today and who slept well, right? And it's a difficult topic, but we know there's significant negative impacts. It decreases your ability to recover. LeBron James talked about how, you know, he spends so much money on his body, but the number one thing he really focuses on is his sleep, right? To help us with recovery, can decrease our risk of injuries, decrease our risk of mental health disorders, anxiety, depression, going into psychotic disorders. And it's something that we really need to focus on, because not just as they're student athletes in college, but they're going to continue with those habits as they go on in life. And so we need to help teach them and educate them on the best ways to really prioritize sleep.
Did anyone hear how bad the beds were in Paris? Anyone? Yeah. So we spent significant time and energy trying to negate how bad the beds were in Paris. And so, you know, it just goes to show you how important sleep is for performance, recovery. And I think it's so simple, and it's some of those things that it's so crucial for health and wellness and performance. And we did a lot of things, and we actually went into Paris doing a huge sleep initiative. And the reality is it's some really basic things that we even gave the athletes earplugs and eye masks. And the thing is you really can get to cool, quiet environments. I mean, the reality is we didn't have air conditioning. We actually put an air conditioning unit in each of the beds, or each of the bedrooms. And so thinking of how basic the sleeping environments need to be, how important routines can be, how getting the athletes or the student athletes off screens. So some of these things can be so basic and so necessary to just be able to kind of normalize sleep and get into a routine, but it is so incredibly helpful for performance and health and wellness.
Yeah, I love this conversation. In SSI, we like to say that if you're looking for a legal performance-enhancing drug, get sleep, because it really is that impactful. So I'm really excited about this next question and the conversation around this. There seems to be a misconception that cannabis or marijuana can improve sleep or can help sleep in some way. However, we know that cannabis actually interferes with your quality of sleep and your ability to get restful, restorative sleep, as well as its possibility to exacerbate mental health conditions. So can you talk to us a little bit about how you talk to athletes about this particular topic and encourage them to think of healthy ways to improve their sleep?
I mean, for us, I think it's just education. And I think it's, even like some motivational interviewing is what we call it in our field, is just, have you ever slept poorly after using cannabis, or have you ever thought about how it's working? That could be cannabis, that could be alcohol, and just kind of working through with athletes, is it actually helping? How is it helping? Because the reality is it doesn't. And so I think it's just working with athletes to understand what puts them in the best position to sleep better. And there is actually strength in numbers and just pointing to how they can sleep at their best. And the reality is it just doesn't help.
I think also understanding why they're having trouble sleeping, right? And so maybe they have a sleep disorder. Maybe they just have obstructive sleep apnea and we just haven't diagnosed it. Maybe they're having anxiety or depression. And so we can treat those things after we figure out the why they're using it. And a lot of times they don't even know why, right? They can't name it. And so I think really trying to investigate that portion so that we can remove it and then give them a better resource to help them sleep.
Yeah, that's great. I do think it's about the education piece and where they're getting their information from in terms of what cannabis is actually doing to their system. One of the things I think about a lot is whether or not performance technologies will help us in this space, right? We know athletes are wearing trackers for different things, tracking their sleeps, and a lot of those trackers come with journals where they can sort of enter oh, I had alcohol today, or I had this much caffeine today, and then you look at those trends. And so just something I thought of that might play into our lives here as performance technologies continue to grow. So what are some of the barriers to sleep that athletes might experience, and how can athletic staff and campuses help to minimize those barriers?
Student athletes are busy. I say as a student athlete, as a biology major, trying to get into medical school, I felt that medical school was a lot easier than being a student athlete in college. And they have a lot of pressure around them. And I didn't have social media during that time. And they have a lot of external things trying to take their attention. And so I think what's important is for everybody to really re-emphasize the importance of sleep. And if you're traveling, how can we adjust the workout schedule the next day so that you can make sure that your athletes get enough sleep versus we've traveled internationally 20 plus hours and then they go straight to practice, And so really thinking about, okay, how can I tell them that we need to have enough time to sleep before we go to train, or decrease the intensity of training because we know you haven't slept because of the logistics with that. And I think it's really also praising those that are sleeping, instead of saying, oh, I stayed up and I only slept 2 hours and I still won that game. We shouldn't be praising that portion because that's a bad habit and a culture that we're going to create around you, but more of what can we have been doing better. And so I think it's really speaking about sleep and thinking of sleep as preparing you for the next day versus ending that day.
Yeah, it should be just as much of a priority. It needs to be a part of the routine. It should be scheduled into the day. It should be just as much of the schedule as it is that workout, as it is putting time into homework, as it is a class. That should be just as much of the daily routine, the schedule, as the honestly 7 to 9 hours. Like there should be a significant part of that day scheduled. And again, as Marcy's saying, it needs to be thought of when you're traveling, and some of those pieces, it could or should be shifting with a practice schedule or some of those pieces too.
Yeah, that's why I love to talk about sleep, especially in settings like this when we're in front of not just medical professionals, but campus administrators and other folks from the membership. Because unless we talk about the importance of this, and unless we acknowledge and name the fact that athletes are busy and they've got a lot going on, but we've already covered that sleep can be, in a sense, a performance-enhancing drug. And so I think we need to be thinking about sleep when we have conversations around scheduling and around traveling, knowing that it isn't going to be completely mitigated, but at least keep it in the conversation. So we'll shift now to some nutrition questions. So when we talk about nutrition and how it's related to student-athlete health, safety, and performance, developing an ideal nutrition plan goes beyond what foods you eat, right? It includes quantity, quality, timing of nutrients to support their training demands. And it also includes considerations for fluids, when and how to hydrate. Data from the NCAA 2023 Student Athlete Health and Wellness Study showed that less than half of athletes in both men's and women's sports feel like they can afford to eat healthy meals or have time to eat healthy meals. And more than half of student athletes want coaches and administrators to talk more about proper nutrition. Recognizing that the topic of nutrition is very broad and very in-depth, what are some common misconceptions that you see around nutrition, and how do you educate athletes about those misconceptions?
Honestly, I think you just called it out. I mean, the reality is there's not enough time or money a lot of times, and so I think it's having those conversations, how do we give athletes better access? How do they find the time or the money to get the proper nutrition? How do we make it really accessible? How do we give them the education to find something that's quick and easy and within their budget to get something? And also that food is fuel, and so there's this really incredible balance between the fuel that they need to have the energy for the activities. And so I think if you're trying to think of how to fuel your body for the activities that are within your day, for the scheduled activities in your day, that's all it's about. And then how do you have the money to be able to fuel your body for those activities? It's actually pretty simple. And the reality is they often just don't have the time for that. And so just how do we put the athletes in a position to set themselves up for success there?
I think regarding the finances, within our annual physicals, we ask about food insecurity or inability to afford food. And whenever we're talking with the athletes or working really closely with our sports nutritionists, and when they say they can't afford food, we try to think of ways, there are programs on campus, there are programs through California that people can have access to food. And not only do they need to be aware of what the programs are, but it's like signing up for insurance, right? It's very tricky. And so we try to help them and support to do the application or whatever that may look like. But if we can do it early, then it sets them up for the rest of their time at college. And we really want to remove that barrier. And to remember that, a lot of people can feel embarrassed or shame with saying that they can't afford food. And so if you're just asking once, it may not be enough. And maybe going back and asking again, saying, hey, are you having trouble, getting your groceries? Or did you have to choose between groceries or your medicines? And asking those questions, so then we can just help support them and really normalize it for them.
Yeah, that's great. And another thing that I thought about when you both were speaking were some of the barriers that I ran into when I was taking care of athletes on campus. And that was sometimes getting athletes to understand that how they fueled in high school may have gotten them great successes, but that now they're in college and the training demands have changed. And getting athletes to change the way they fuel to compensate for those changes in training demands, those were hard conversations sometimes. And I think a lot of it had to do with you know, as an athlete, you know what foods you can tolerate, you know what foods make you feel good and what foods don't make you feel good. And thinking about changing those patterns can be uncomfortable for an athlete. Have you guys experienced kind of similar things? And how do you work through that?
Yes, definitely. I think when they get to college, it's a difficult transition, and not only is your training output very high, but for us at UC Davis, there's a lot of biking. You know, some of those kids are biking 300 minutes a week just to get to class. And so we have to add that into how much energy they're using that maybe they're just not aware of, because for them it's a light exercise. And there's so much information on social media out there that it's hard for them to know which should I be doing, or is this trend what's most appropriate and what's going to get me the best results. But I think our sports nutritionists and what we as the physicians try to do is just simplify it, right? Our proteins, our carbs, our fruits and vegetables, because if we can simplify it for them, then it removes more decision making and more understanding of what they need to do, and hopefully they can follow those trends, make those changes.
Yeah, I find that happens all the time, that they start to like listen to somebody or something that is not a reputable source, and I'm like, where did you hear that? Or, you know, like, and so again, from high school to college, who they start to listen to or who they've been exposed to often changes as well. So they've had their parents, and then who they've begun to listen to may also have shifted as well. So that's another change that also comes. So they may have been comfortable with one thing in high school, but that often shifts at the collegiate space as well.
Yeah, I think this speaks to the importance of the relationship between the student athlete and their athletic trainers, their team physicians, their dietitians, because I think when the relationship is there, those conversations are easier. Like, hey, where did you get that info from? And let me supply you with some education that might be a little bit more accurate. So we also know, of course, that lack of proper nutrition can have significant impacts. The past few years have seen a lot of development in research related to low energy availability and relative energy deficiency in sport, or RED-S. Can you talk about some of the research developments in these areas?
Yes, so to back up, so relative energy deficiency in sport, the way I explain it to them is what you put in your body, what you're eating, subtracted by how much energy you're using, how much you're exercising, but also getting to class, living life, equals how much energy you have available in the body. Pretty simple, right? But if you're not eating enough, or you're expending too much energy, then the energy you have available in your body for your heart and your lungs and your GI system to work is too low. And so when it's chronically too low, it leads to all of these changes, which what's important to them and to you all is they can't train as well as they used to. Maybe their numbers are getting elevated versus decreasing. Maybe they're not producing the results that they want during that time. Increased risks of injuries. They get sick more often. If you have an athlete that's always has a cold, you know, we think of cold as such a light thing, but if it's happening over and over, we have to think, why do you keep getting sick? And so there's a lot of ramifications from being chronically in that low energy balance. And the International Olympic Committee just a couple years ago came out with an updated consensus statement about how we're treating this, because we're seeing it so prevalent, and it's usually unintentional. People are just not aware that they're not eating enough for how much they're exercising.
I'll just say that was a landmark paper that team physicians across the country were excited to see that work, and it changed management quite a bit.
Yeah, and I think it's important to recognize too, there used to be this thing called like the female athlete triad, or if you've ever heard of anything with eating disorders or anorexia or some of these things, like all of that started to shift around this time because it was also very focused on females and losing your period or menstruation. And the reality is we started realizing it's actually happening with both genders. And so again, landmark papers where we're realizing it actually is just this balance between energy and fuel, and it could happen with either gender, and it really, really impacts performance. And so it's something fairly simple that impacts the entire body and the way that athletes are performing. So again, the IOC, or the International Olympic Committee, landmark papers that are coming out around how often unintentional, and again, when you think eating disorders and some of these other pieces, really can have an impact if the body is not fueling enough for the amount of energy it's expending.
And I think another really important point on this topic is that these occur on a spectrum.
Yes.
Right? This is not just, do you have an eating disorder or not? The low energy availability piece is very much on a spectrum, and athletes can fall anywhere on that spectrum, from just having patterns of eating that are inadvertently, not resulting in enough energy, to really full-blown clinical eating disorders, and anywhere in between, and again, both genders included on that spectrum. So really want to hear your opinions on sort of multidisciplinary teams that are sometimes required to manage patients, not just with eating disorders, but even athletes that are suffering from RED-S. I know at UConn we had a team that would meet every other week to discuss these cases, and we'd just love to hear your thoughts on the idea of a multidisciplinary treatment team for these folks.
Yeah, we've actually gotten together a panel at the USOPC that involves medical providers, athletic trainers, physical therapists, dietitians, physiologists, mental health therapists. We have OBGYNs. We have all kinds of specialists, and we actually get together once a month to review cases. And so we allow any sport across our what we call national governing bodies, so US soccer, US swimming, and we open it up to any case, any athlete. Athletes can come actually and just ask questions themselves. And so we produce education, and it's so very helpful to have different lenses and understand the impact that there could be around the fueling piece. Again, there could be GI issues, and so there's a lot of different things that come up. And then you're also looking from the lens of a psychiatrist or a mental health provider, and it's so very helpful to understand holistically what could be going on if there is not enough fuel for the amount of energy that an athlete is expending. So that holistic lens of being able to look at an athlete and understanding the different aspects, the different consequences of that is so very important. And I think that's where we're really headed when we're looking at an athlete, is just to be so very holistic about it.
That's great.
We similarly also have a multidisciplinary team, and even when we do education about REDS for certain teams, and we try to actually hit all of the teams, not just the female teams, but we see it in football, we see it across all of the sports. For women, it just can be a little bit easier because they can lose their menstrual cycles, which is very common, but it's not a normal part of the body, and so we want to really educate about that. Or we see a lot of bone stress injuries or stress fractures. But even when we do those talks, we bring everyone, our physicians, our sports nutritionists, our sports psychologists, our mental health providers, because we want everybody to know it's a team that's going to help take care of this, and this is how important we feel it is.
Yeah, that's great. And I always like to end every conversation on this topic with the importance of screening and making sure that folks are screening their student athletes for these conditions, because they do not always present in a very obvious way, and so screening can be very helpful for that. So as we discuss all of these health, safety, and performance topics, I think it's important to recognize the impact of times of transition in sport. We know that times of transition can be times when mental health symptoms may present. When we talk about times of transition, we're not just talking about transition out of sport, like when you're injured or when you graduate, but also transitions within sport, such as re-entry after treatment for a mental health condition, or even transition into a new team. So in your experiences, what practical strategies do you recommend for coaches and for sports medicine staff to be able to support their athletes during times of transition?
I think that first and foremost, understanding that it's a difficult time. Change is hard, no matter what. And sometimes they talk about, good or positive changes can be harder than those negative ones because less people are paying attention to it. But the coaches, you guys spend the far majority of the time with your student athletes, and you know them the best. And so talking with them and saying, we know this is going to be a little bit challenging as we get you back into that sport, or as you're graduating out of college or transferring, and talking to them to find out where do they find stress in it, so that we can help support that. And if you guys need other support to help them, then you can reach out to your athletic trainers, your physicians, your sports psychologists, whoever it may be that they need support for. Remember, or maybe it's just career guidance and what that looks like. But for the coaches to continuously check in with them, especially when you're noticing changes, I think that's the most important part.
Yeah, and at the USOPC, we actually have what we call pivot programs, and so we've really tried to normalize pivots. And so we call the onboarding process a pivot. So welcome to Team USA, offboarding is a pivot, and then there's pivots throughout your career. And so we like that there's a number of pivots. We obviously are a bit different with student athletes. We have pivots when athletes may become a mom or a dad. There's other times where maybe their parents are going through a divorce, maybe they go through a divorce themselves. So there's pivots throughout their lives, and there could be things that go on. So we try to really recognize that there's different pivot points throughout their lives. And so again, the more we normalize that there could be an injury, welcome to Team USA, or congratulations, you've made a team or a games, congratulations, you've kind of moved on in your career to the next phase. And so the more we normalize that there's always going to be lots of transitions, or again, welcoming a baby, I think that's going to, again, there's always going to be pivots, and that's a really exciting thing.
Yeah, I think it's important to remember that, student athletes are more than just their sport. They're going through things emotionally and developmentally, and making sure that we are all thinking about how to support student athletes through some of that, in addition to supporting them through their athletic performance, I think is really important to always keep top of mind. So thank you for your insights on that. So let's broaden the lens a little bit and look at those that support our student athletes on campus. So the NCAA athletic trainer workforce issue and the mental health best practices have both called attention to the importance of athletic trainer and coach well-being as it relates to them being the ones that are supporting our student athletes. So what practical strategies can you recommend for member schools to support coaches and sports medicine staff, recognizing the huge role that they play in supporting our student athletes?
Honestly, I think it's, we talk a lot about self-care, and I think when we're at events, especially us as mental health providers at a games environment, we're tasked with taking care of the staff just as much as the athletes. And we do a lot of training heading into big events, such as the Paris Olympic and Paralympic Games, around taking care of yourself so you can be at your best to take care of the athletes. And it's so simple and often so silly, but taking I'm sure a lot of people flew here, putting your oxygen mask on before you help someone else put their oxygen mask on, and you really can't help anyone else if you're not helping yourself. And it could be so simple, and I'm sure so many of you have heard that before. But it's so very true, and I think that's where we have to help ourselves to help others, and we do that on our teams, and we try to support each other. We try to set boundaries and try to be at our best. There's actually quite a bit of literature on us being performers as well. How do we be at our best? How do we perform at our best, and what do we need to perform? What do I need to get up here and speak to a room full of people I don't know? And so again, we have to do that as well. And so how are we at our best? And again, there's a growing body of literature on that as well.
Yeah.
Within USA Gymnastics this past year, we've had a lot of discussions about coaches' mental health, especially going into the games, and how the coaches feel is a lot of times how the athletes will feel. And we were actually able to implement a wellness room at competitions. We're gone for about a week, and then they had the therapy dogs come in, and logistically, probably every university can't do something like that, but really thinking about smaller things you can do to support your staff that can help to increase the morale around them. And that might be discussions with them and having focus groups, and just recognizing that everybody's a human in this. Everyone has stress within this, from our administrators, the coaches, the athletic trainers, the physicians. Everybody in that room has a little bit of stress, as they should, but how do we help talk about it, and then how do we help do those small things to help support it?
Yeah, that's great. I think it's really important for us to continue to focus on those that support our student athletes. And so thank you for your insights on that. So we're actually coming to the close of the formal discussion here, but at this time I'd love to welcome you both to make any final comments that you might want to about the topic so far.
I think I had a different comment, but as we were talking, I'm thinking and reflecting back, and I was a 3-sport athlete in high school. I was pretty good, and then I got to college on a scholarship, and I just remember constantly feeling like, oh man, I didn't do good enough, or even if I won, I should have jumped higher or ran faster, and really never just sitting in the success and the hard work that you're doing with my teammates and my coaches, and just feeling like maybe I wasn't that good, you know? And then a couple years ago, I was inducted into the Hall of Fame in my high school, and a couple months later at Loyola Chicago. And I just really stopped to reflect, to say, I can't believe I spent so much energy thinking that I wasn't good enough during that time, because we just never stopped to say, let's look at our success, and let's look at what you've done, or what you've overcome, or your resilience, or how you're gonna get over that. And I guess my message is to stop and reflect about what you're doing, and really encourage the student athletes to do the same, because they're coming in with significantly more pressure with social media that's telling them how they should feel, but they should really feel good in themselves that they're even student athletes and they made it this far, and that in itself is a success.
Oh yeah, that's a good message. And I mean, I think that is such a good message to reiterate, is that these student athletes have so much to balance, and that mental health is such a big part of it. And I mean, I think that from my time as an athlete and coming to what these athletes now are balancing, and mental health is such a big part of it now. And I always think, you know, the message we try to say is mental health is health, and it is such a big part of their identities now. And there are so many mental health struggles. Fortunately, it seems to be less stigmatized, and there's more folks talking about it now, but I do think it is so very important. Awareness is raising. Ask questions. I think that's so very important. Ask questions. And what I'll also say is, if you don't know what to do, ask the questions, and there are professionals on your campuses that know what to do. So there are emergency action plans out there. There's even, again, you know, organizations out there like the USOPC. If you ever struggle to know what to do, there's usually people that know what to do. So.
Yeah, I love that as like a closing remark, ask questions, because I know in SSI we get a lot of questions that we actually do have a lot of great resources that already exist to answer those questions. Yeah. And so if you don't ask them, we won't be able to help you and direct you to where all the answers are. So I really appreciate that. So I think we'll turn now to some audience questions. So the first question says, with an enhanced focus on student athlete health, safety, and performance, we are seeing a challenging time in the athletic training world related to recruiting and retaining athletic trainers. So any kind of thoughts, comments, advice that you all have on that topic?
You know, we've experienced it, and I think especially during COVID, it really highlighted the amount of work that athletic trainers do. And athletic trainers at baseline work very hard, you know, and for small amount of pay typically. And then during COVID, we wanted them to be compliance officers. We wanted them to regulate the kids' COVID, the coaches' COVID, and they had to keep that trust with the coaches, but then they had to follow what the sports medicine and the medical world was telling them. And it's a hard position to be in. And we really recognize that and really try to communicate with them and figure out how do we support them, right? Similar to your last question is, how do we support their mental health, and how do we take away maybe some of those duties that are a difficult position to be in for themselves and remove that from them, right? A lot of times it's discussions of, you know, don't have that discussion with the coaches. As a physician, that's my job. Let me be the bad person, and I can do that because I don't have to be with the team every day. Yeah. I don't have to communicate with the coach every day. But I agree that it's a difficult position for them.
It is. Mm-hmm.
Yeah, and I think I would just add, I mean, what we've talked about too is they have mental health as well. And so I think it's just understanding that they're whole humans as well. And so all of the things that they would have to balance. So it's like the more we understand that student athletes are humans with lives outside of sport, and so are athletic trainers, so are all of us. And I think that's so very important to understand that work-life balance and all the things. But I think Marcy makes such a good, like the job responsibilities and all the things that we're putting on athletic trainers, on student athletes, on the administrators, on the coaches. All of those are so very important to continue to evaluate and reevaluate in times of COVID throughout the year. That's always going to be very important.
Yeah, we're having a lot of conversations on this topic across the membership because it is such an issue throughout. And I think one of the most important things that I think about is just simply keeping athletic trainers in the conversation. Giving them a seat at the table when decisions are being made about certain things, whether it's scheduling or just keeping their voice kind of heard, I think can be one step towards hopefully change to what is a very complicated problem. So do you have any resources or recommendations for institutions who may not have a lot of resources or services like embedded sports nutritionists or sports dietitians?
Ooh, I think there's a lot of external resources, and I would say that there's not always. I think there's oftentimes a lot of folks that want to help. There's a lot of community resources. I know particularly from working at the USOPC, like we get offered a lot of times, like, how do I break into sport? Or it's really exciting city or college. And so I often say go into the communities. And so that's one of my best pieces of advice is just go into the community. There's often people who want to give and give back to their communities. And so, just looking out in the communities is often something that can be really important. We use a lot of graduate students, we use a lot of students. So that's something to be really creative around if you don't feel like you have them within your community.
Yeah, and I would add to that and say, just looking on your campus for the general student population, I saw that a lot in real life where, we would say, oh, we don't have the money to hire, this person, but there's one on campus that services the general student athletes, and we have to remember that our general students. We have to remember our student athletes are students at these schools, and so if there are resources that are embedded into the general student population, athletics can draw on those resources.
The other thing would be to talk to your physicians. If you have a sports medicine physician that comes to your university, or maybe you don't, but as student athletes are going to see their doctors, ask them. And usually if they don't have that answer, they can help continuing to connect you to those community resources. But I agree, there's a lot that want to help, and it's, I think, both ways of how do we connect everybody, and a lot of that is just starting that conversation.
That's right. So I think we have time for one more question. So how can we support coaches who are well-intentioned but don't know where to start or are hesitant to be having conversations with athletes related to their well-being and mental health?
I think first, recognizing where you sit within that, as a coach, what makes you nervous to talk to the student athletes. And mental health is difficult, even myself, I do a lot of it, but sometimes people tell you really difficult things and you don't know how you're going to respond or how you can support them. And I think first and foremost, most people want to just be heard and validated. And so just sitting and talking with them, and then remembering that you have your resources around you, right? Your job is to be aware that there's a problem going on, but then get them to the place that you want them to be within that. And a lot of student athletes, they hold different identities, right? And that can be difficult. And we know there is not enough therapists and specialists that are of minoritized backgrounds, whether that's racial, ethnic, sexual orientation, whatever that may look like. And I think it's okay to name that maybe we don't have somebody that you might gel with as much as you would like to, but let's at least start this process to get you the help that you need, and then we can continue to work towards that. But to not minimize that portion of it, but just to say, I don't really know this answer, I can talk to you right now, and then let's get you to X, Y, or Z.
Yeah, I don't think I could have said it better. If you could just start it, like understand like why are you so hesitant to start the conversation, but just to start, like is there some way to start a conversation to understand what that athlete might be needing, to ask a question, and again, for the most part, I would assume your role is not to fix, it's not to treat. Right. It is typically to just ask the question. And then again, there's so many places that you could potentially send this athlete that would be a great resource.
And I think when we think about programs like mental health first aid and how these types of training programs might help coaches and administrators feel more comfortable having these conversations if they've maybe got a little bit of formal training and sort of how to begin. Because I can imagine as a coach with no background at all in counseling or in mental health conditions, you're a little hesitant to say the wrong thing. Or right. So I think this is where things like mental health first aid can be really, really helpful. So I think we're out of time. So I just wanted to say thank you so much to our two panelists. This has been a really vibrant and spectacular conversation. And thank you all to the audience for joining us today for the featured session. We really appreciate your attendance.